What are you doing here on YouTube? Are you looking for advice? There's a lot of advice. How to fix your car, how to grow a garden, even things like how to tame an animal, how to pick locks, how to do magic tricks. And there is advice about how to manage your stress, relaxation exercises, lots of videos about yoga, how to think positive thoughts. But you know what YouTube is not? It's not psychotherapy, because psychotherapy is not about advice. And yet, many people have that idea. It's a kind of a myth or a misconception. In this 7th video, we're up to 7 already, I wonder how many I'll have. In this 7th video, where I debunk myths about psychotherapy, I'll set the record straight. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Stay tuned. Giving or getting advice is the most natural thing in the world. It's the way we're raised. Look both ways before you cross the street. Don't touch that hot stove. Don't take candy from strangers in sketchy, unmarked white vans. And there's lots of sources of advice. We get lots of advice from our family, from our friends, books and movies and videos, and lots on social media as well. Some therapists or therapy services even suggest that they mainly offer advice, that they offer tips or tools or strategies to help you live a better life. I did a recent video on that, suggesting that that's not really what psychotherapy is about. You see, psychotherapy isn't advice. For one thing, we therapists, although we have, most of us, advanced degrees and are pretty smart, are not so smart that we know how to tell you how to live. We're not experts on how to live. We're experts on something else, how to reflect on your own life and your own feelings to help develop your own strategies and thoughts about how to live. And in particular, we don't know you, especially not at first. We don't know what your goals, what your values are. How can you take advice from somebody who isn't you? As a result, advice is often generic. It applies to people in general, not to you specifically. And if you think about it, any advice you get from a mental health professional or really anyone else is biased. If you were seeing me and I was your therapist and I said, really, I think it's good for you to get married, you would immediately wonder, is that because I have a bias about people who are married or being happier than people who aren't, or that I have a happy marriage, or, some idiosyncratic reason that I say or think that? And the point is, I could just as easily say, I think the better advice for you is not to get married. And the same question comes up. Is that because I've had a bad marriage, or for some reason I have a bias about that? And that's true of any advice you get from a mental health professional or really anybody else. It's based, at least in large part, on the advice giver's own idiosyncrasies, their own background, not yours. Now, I should note, therapy often includes some advice, or if you count suggestions, it often includes suggestions. And sometimes these are so obvious that it's hardly worth mentioning. If a psychotherapist says, please put the gun down while we're talking, yeah, that's advice, but thankfully it doesn't come up very much. Or, in the future, don't come to therapy drunk. Okay, that's advice. Sure. And we also give advice, again, this rather generic, because we think it's therapeutic in general. You should exercise, you should eat well, you should get good sleep. Maybe journaling will be good for you. Or maybe you should develop some habits regarding stress management. But that's very different than advice directed specifically for you, what you should do about your relationship, or what job to pursue or what hobbies are good or not good. Mistaking advice for psychotherapy is an honest mistake for clients or patients. After all, our whole culture revolves around giving and getting advice. Be a natural thing to assume. But it's sheer laziness or misunderstanding on the part of mental health professionals to suggest that tips, tools, strategies, or advice in general constitutes or makes up a large part of what psychotherapy is, because that's not true. Advice that applies to most people most of the time should go into books or podcasts or blogs or videos, not into one-to-one therapy with a trained professional that you're paying money for, or your insurance is, to give you an experience which is uniquely for you. Ultimately, psychotherapy aims to help you live your most full, self-directed life. If you receive advice from a therapist, it's really kind of counterproductive. May be helpful in the short term, but ultimately, it's going in the wrong direction. Real progress in therapy is when you follow your own inclinations, your own wishes, your own direction. In that sense, advice is limited. It's small. It treats you like a kid. Make sure you look both ways before you cross the street. It doesn't honor your autonomy, your right to live your own life, your right to make your own mistakes and to learn from them. No one has an instruction manual for life, so don't seek one from a therapist. Instead, use psychotherapy for its real value, to help you understand yourself better, your underlying feelings, the relationship between feelings, the patterns of feelings and relationships in your life, and then chart your own course. Well, that's it for today. Please like this video if in fact you like it. Please subscribe if you have not already. As mentioned, this is part of a series on myths about psychotherapy, and this is the playlist where you can see the rest of them. Thanks, and I'll see you next time.